Let's say I just did a PainSpot quiz, and one of the possible diagnoses is ankylosing spondylitis. Well, that could be concerning or scary. It's better to find out early whether you have it or not than waiting and just hoping that it might go away. One of the difficult aspects of diagnosing ankylosing spondylitis is that there's not a particular test that, for instance, if you go in with a sore throat and you get a throat swab and it comes back strep, well, you've got strep throat. Ankylosing spondylitis is not like that. If there's any chance that you think you might have ankylosing spondylitis, just as with any disease or specialty, make sure you see someone that is specialized or trained at recognizing and treating that condition. That would be a rheumatologist. There are very many good practitioners out there that can recognize it early in the course of the disease, but once it comes time to confirm the diagnosis and specifically to treat it, rheumatologists really are the people that treat ankylosing spondylitis. When you see a rheumatologist, we go through first a history of your symptoms. Generally, about 80% of people with ankylosing spondylitis will develop symptoms before they're 30 years old. So it really is a disease that occurs in the youth and younger people. That is kind of a red flag, particularly if there's no history of an injury or something like that. Then we go into physical exam, and your rheumatologist will check for tenderness and swelling in your regular joints, redness and things like that, but really probably focus more on your spinal symptoms and spinal exam. And this has to do with checking, how well you move, the range of motion, if there's been any stiffness, posture is checked, how well you can touch your toes or how close you can get to the floor when you bend over is one test. How well the lower back moves when you bend forward. It should not be straight like this. It should actually form sort of a curve, and we can actually measure that. Also, we look for tenderness along the spine and in the low back joints where they attach to the pelvis. Those are called the sacroiliac joints. Then we check for instance, how well you can expand your chest, because sometimes you have a restricted range of motion when you try to take a breath. Then we talk about blood tests. Blood tests have to do with looking for genetic markers, a genetic marker in particular. This is a test called HLA-B27. It's actually a genetic marker for that represents a risk factor. Now, if you have that, and you have the symptoms and the clinical findings that would go along with ankylosing spondylitis, well, that really raises the index of suspicion that, yes, we have to really make sure that we're not missing ankylosing spondylitis in its early stages. Some other blood tests that we'll do will be looking for signs of inflammation. One is called the erythrocyte sedimentation rate, affectionately called the SED rate. Another one is a CRP, that stands for C-reactive protein. They both measure inflammation in our bodies. In addition, usually x-rays are done, but it's important to realize that these may be normal in the early course of the disease. Sometimes we will do further imaging studies, particularly if we're not sure that we may be dealing with ankylosing spondylitis early in the course of the disease. These are more sensitive tests for inflammation. MRI is one of these tests that can be done. It actually will look for inflammation within the bone, in the bone marrow, around the pelvic bones. What if you have an appointment to see a rheumatologist? Don't worry about complaining. Complaining is for us data. So it's better to give a little bit more data specific to the symptoms that you're having that you think might be ankylosing spondylitis. In particular, if you say, I never used to wake up at night, and now the pain is waking me up at night. Or perhaps you say, I'm so stiff all day, I just can't get rid of this stiffness. Or I used to be able to touch my toes no problem. Now I just can't do it anymore, and I don't know why. I haven't had an injury or an accident. I just can't explain it. Remember that if you have mechanical back pain, the treatments are all different than ankylosing spondylitis. So, for instance, let's just make the scenario that you have been diagnosed with mechanical back pain, and you've been to physical therapy, and you've had x-rays and they don't show much, and you're just not getting better. That's the time to go, not just to ignore them again and just say, oh, I'm going to have back pain my whole life. That's when it's important to get back into your provider's office and say, I did everything that I was supposed to do. Do you think maybe we could order some blood tests or that genetic marker, or maybe even get me in to see a rheumatologist, because I'm worried that I might have inflammation in my spine as opposed to just mechanical pain.